In a political landscape already fraught with division, a single word can ignite a firestorm. Vice President J.D. Vance has provided just that, labeling deep cuts to a vital healthcare program as minutiae. His comments have sparked outrage and drawn sharp battle lines. The controversy surrounds the administration's new budget proposal, a massive piece of legislation some have dubbed the One Big Beautiful Bill. This bill outlines a dramatic reshaping of national priorities, and at its heart lies a contentious trade-off that is now under intense scrutiny. At the center of the storm is this quote from the vice president on social media: "Everything else, the CBO score, the proper baseline, the minutiae of the Medicaid policy is immaterial compared to the ICE money and immigration enforcement provisions." This has left many asking, what exactly is being dismissed as minutiae? Let's break down the numbers. The bill proposes cutting over $1 trillion from Medicaid and the Children's Health Insurance Program over the next decade. The Congressional Budget Office estimates this could lead to more than 10 million people losing their health coverage. For millions of Americans, Medicaid is not an abstract policy. It's a lifeline. It provides essential health care for low-income adults, children, pregnant women, the elderly, and people with disabilities. The proposed cuts represent a fundamental shift in the nation's social safety net. So, what does the administration see as more important than these healthcare provisions? The answer, according to Vance, is immigration enforcement. The bill allocates a staggering increase in funding for Immigration and Customs Enforcement, or ICE, to the tune of hundreds of billions of dollars. This funding is earmarked for a significant expansion of detention facilities, the hiring of thousands of new ICE agents, and the technological infrastructure to support a large-scale deportation operation. The administration has made it clear that this is a top priority. The vice president's supporters argue that the focus on immigration is a matter of national security and economic stability. They contend that the current immigration system is unsustainable and that a more aggressive enforcement strategy is necessary to regain control of the nation's borders. They argue that the long-term costs of unchecked immigration outweigh the immediate impact of the Medicaid cuts. From this perspective, Vance's comment was not a dismissal of people's struggles, but a stark statement of the administration's core policy objectives. However, critics from across the political spectrum have been unsparing in their condemnation. Democratic Representative Ro Khanna, for instance, questioned what had happened to the J.D. Vance who wrote Hillbilly Elegy, a book that gave a voice to the struggles of the working class. Khanna and others point to the potential for a devastating impact on rural communities, where hospitals are often heavily reliant on Medicaid reimbursement. The closure of these facilities could create healthcare deserts, leaving residents with limited or no access to essential medical services. Healthcare advocates have been quick to paint a grim picture of the potential consequences. They warn of a rise in medical debt, an increase in untreated chronic illnesses, and a strain on emergency rooms as the uninsured seek last resort care. The debate has also brought to light the internal divisions within the Republican Party. Several GOP senators have expressed serious concerns about the Medicaid cuts, with some even voting against procedural motions related to the bill. Their opposition highlights a growing unease with the administration's hardline stance. These dissenting voices within the GOP are wary of the political fallout from what they see as a direct attack on the well-being of their constituents. They understand that while immigration is a potent political issue, so is the ability to see a doctor when you're sick. The bill also includes a host of other controversial provisions, such as work requirements for Medicaid recipients and changes to how states can fund their share of the program. These measures, critics argue, are designed to create bureaucratic hurdles that will push even more people off the rolls. The administration defends these requirements as common-sense measures to ensure that public assistance is reserved for those who are truly unable to work. They argue that this will encourage self-sufficiency and reduce the burden on taxpayers. Opponents counter that many Medicaid recipients are already working in low-wage jobs, are caregivers, or have health conditions that make steady employment difficult. They argue that these new requirements will simply punish the vulnerable. The controversy over Vance's comments has also reignited a broader debate about the role of government. Is its primary function to secure the borders and enforce the law, or to provide a social safety net for its most vulnerable citizens? This bill forces that question into the open. The administration's focus on immigration is not new, but the scale of the proposed funding, and the willingness to sacrifice a major healthcare program to achieve it, marks a significant escalation. It is a bold, and many would say, a ruthless statement of priorities. The long-term political ramifications of this move are yet to be seen. Will voters reward the administration for its tough stance on immigration, or will they punish them for the deep cuts to a program that so many rely on? The upcoming elections will likely provide an answer. For now, the debate rages on, fueled by Vance's immaterial comment. The word itself has become a symbol of what critics see as a callous disregard for the struggles of ordinary Americans. It has given a powerful rallying cry to those who oppose the administration's agenda. As the bill moves through the legislative process, every yes vote will now be seen through the lens of this controversy. Lawmakers will have to decide whether they stand with the vice president's assessment that the minutiae of Medicaid policy is a worthy sacrifice for the sake of immigration enforcement. The story is far from over. The bill still faces a difficult path in the House of Representatives, where a narrow Republican majority and a vocal contingent of moderates could stand in the way of its passage. The coming weeks will be a crucial test of the administration's political power. Ultimately, this is a story about more than just a single piece of legislation or a controversial comment. It is about the very soul of a nation and the values it chooses to prioritize. The outcome of this debate will have a profound impact on the lives of millions of Americans for years to come. The repercussions of this bill and the rhetoric surrounding it will undoubtedly be a central issue in the political discourse for the foreseeable future. We will continue to follow this story as it develops. Thanks for watching.